Hi, good evening friends. My name is PANKAJ ARORA and today we will look at EEG 1020 placement and hookup for video polysomnography. The objective of my session is to look at role of each electrode, to locate the EEG placement landmarks in 6 easy steps, why it is called as 1020 system, and we will also see in placement and practical on a dummy. Why it is called as EEG 1020 system? Because either each electrode is either placed at 10% or either at 20%. We will see in the next subsequent slides. So in video polysomnography, we are looking for frontal channels, central channels, and occipital channels, and each electrode has role to play. Uh, but however, in case we are using an EEG extended montage, we need to have temporal and parietal lobes. In case of EEG extended montage, as well as in case we are looking for epilepsy patients. So what ASM recommends for sleep PSG montage is it recommends frontal channels, that is F3, F4, central channels C3, C4, occipital channels O1 and O2, and each channel has some role to play. We will see in the next slide. We also need to have mastoids, reference and ground. So it means we need to have 8 electrodes plus reference and ground, 8 EEG plus reference and ground. We also need to have ocular channels and also submental EMG, that is EMG channels. EOG and submental EMG is needed to differentiate between RAM and non-RAM stages. So as I told you, why we need so many channels. So frontal F4 or frontal channels will give you delta sleep, that is characteristic of stage 3. It also gives you K complexes, actually, which is a part of stage N2. Central gives us spindles, that is a characteristic of stage N2. Occipital gives us alpha waves, which is a characteristic of wake, stage. So ASM recommends F4, C4, and O2 as a main channels, which will be referred with M1. However, it always recommends to have a backup. In case frontal F4 comes out, then we have to have a backup of C3, F3, C4 comes out, we have to have a backup of C3, and O2 comes out, we have to have a backup of O1. So it recommends as a backup electrodes of F3, C3, and O1, which will be referred to M2. So before the patient arrives, we need to do the preparation for a hookup, and we need to prepare a tray which will have the EEG electrodes. Then we have to have a razor, we have to have a scissor, we have to have a pen marker, we have to have tubes, then we have to have an earbuds, we have to have inchy tape, and we have to have gloves, and we also need to be ready with the tapes, so that there should not be time wasted when we are doing this patient hookup. We also need to check up the equipment, that it should be working properly, because once the patient has come and the equipment is not working, all of our uh, whatever work we have done will go haywire, and then we will not able to do the study. So once the patient arrives, we have done the hookup of respiratory parameters, respiratory channels. Now we are looking for a EEG hookup. So we are talking today of EEG 1020 placement, or locating these landmarks, locating these electrodes. What we need to do is we need to locate the 4 landmarks which are really important, and that is nasion, enion, right preauricular point, left preauricular point. So where is the nasion? So nasion is the point where our nose meets the forehead. So meeting point of nose between nose and forehead is a nasion. So finding enion is slightly difficult. So what we need to do is we have to move. Just take your hand from the nasion, from the center, move backward, and just put your head backward, and where your skull is ending towards the neck, you will find the occipital protuberance. That means you will find some bony area here, and where this bony area ends, where this occipital protuberance or bumpy area ends, this point is called as enion. So we have found the nasion, we have found the enion. Now these two notches which is in the ear, you can feel yourself, these are called as preauricular points. So these 4 points has to be located first. This is step 1. Step 2 is, once you find these points, you need to measure from nasion to, anion through intuitive. You have to have a good intuitive. So in generally in adults, the length from nasion to anion is between 32 to 36 centimeters. So what we need to do is from nasion to anion, for example, is 36 centimeter. Passing from nasion to anion, from the center point, we need to locate the 50% between nasion to anion. So this point is basically called as CZ, which is the most important location for all EEG, one of the most important location for EEG electrodes. So once we have found the CZ, we have to move forward towards nasion. So from CZ, 20% in the frontal side towards nasion is FZ, 20% above the nasion is FPZ, and from FPZ to nasion is again 10%. So for example, this whole area is 36% or 36 centimeters. From CZ to FZ will be 7.2, and from FZ to FPZ is again 7.2, and from FPZ to nasion is 3.6. Similarly, once we go back from CZ to union CZ to move backward 20%, which will be called as PZ, and from PZ move backwards 20% will be called as OZ, and OZ to 10% will be union. So now we have measured. Now moving back from union backwards, from backward to forward is from union to 10%, forward is OZ is 10%, from OZ to PZ is 20%, PZ to CZ, PZ to CZ, CZ is the most important location I told you, is 20%, CZ to FZ is 20%, FZ to FPZ is 20%, FPZ to nasion is 10%. So we have found this, but our main interest is to find C3, C4, F3, F4, and O1, O2. So since we have not found any of these landmarks till this time, so what we need to do is we need to go to the next step. We need to measure from this preauricular point to this preauricular point, passing through CZ. So what we need to do is, as I told you, from measuring from this point to preauricular, to left preauricular to right preauricular, which is again 32 to 36, 32 to 36 centimeter in normal adults. So what, and it should pass the point where we have already marked as CZ. So this point where this cross section is actual CZ. So from now CZ towards left preauricular point, 20% is C3. Again, 20% back towards left preauricular point is T3, and from T3 it will be 10% to preauricular point. Similarly, in the right side, CZ to C4, so CZ 20% right will be C4. From C4, 20% right is again T4. T4 10% is right preauricular point. So now what we have done is we could find C3 and C4, but occipital channels and frontal channels are still missing. So we have to move to the next step. So before we move to the next step, I would just want to remind you that we have found FPZ already. We have found T3, we have found OZ, and we have found T4. So what we need to do is we need to measure the circumference starting from FPZ, passing through T3, passing through OZ, passing through T4, moving back to FZ. So this is what we are doing in the next step. Starting from FPZ, passing from T3, passing from OZ, passing from T4, moving backwards to FPZ. So this is how you need to measure the circumference of the head. And generally it is 56 to 58 centimeters in adults. So now from FPZ, move backwards 5%, which will be FP1. Again, move backwards towards OZ 10%, which will be called as F7. Move backward 10% will be 10.3. Move backward 10% will be T5. Move backward 10% will be O1, and move backward 5% will be OZ. So two things I just want to inform you about this at this point is, I told you this is called as 10-20 system, but here these are the exceptions. Like from FPZ to FP1 is 5%, FPZ to FP2 is 5%, and OZ to O1 is 5%, and OZ to O2 is 5%. Since we have taken the whole circumference, it is calculated as 5%. But if we would have taken the half of the circle or one hemisphere, then we would have been actually again 10%. So that is why it is called as 10-20%, 10-20 system, because either of the electrode is placed at 10% or 20% to each other. And One more thing I want to inform you about this at this point is left side of this hemisphere is always denoted by odd numbers. Right side is always denoted by even numbers. So that is the reason if you see in the slide, we are moving towards from FPZ to OZ. This is left side. FP1 is 5% is FP1, 10% is F7, 10% is T3, which we already had. T3 backward, 10% is T5. T5 backward, 10% is O1. Similarly, in this case, right side will be F2, F8. F2 is 10%, 5 F2, FPZ to 5% is FPZ. FPZ to F8 is 10%. F8 move backwards, 10% is T4 we already had. T4 move backward, 10% is T6. Move backward, T6 10% is O2, and O2 to OZ is again 5%. So in this case, it is generally 56 to 58 centimeters. So FPZ to FP2 is 5% is around 58, 5% is 2.9. FP2 to F8 is again 5.8. If it's 58 centimeters, F8 to T4 is again 10%, 5.8, 5.8, 5.8, and 2.9. Similarly, is the same in case of left side also. So what we have done in this case, we could find O1 and O2. We already found C3 and C4, but F3 and F4 is still missing. So we have to move to the next step. So what we need to do is, we already know we have FP1, we have O1, we have FP2, we have O2, and we have C4 also. In this case also FP1, C3 and O1, FP2, C4 and O2. So what we need to do is, we need to take an inchy tape starting from FP2, starting from FP1, passing through C3, moving towards O1. Again repeating FP1, C3 to O1. So suppose this is 28 centimeters. Just an example. If it is 28 centimeters, so FP1 to C3 will be 14 centimeters, obviously, because if it is 28, it is 14. So just 50% from FP1 to C3 will be marked as F3. So this is 50%. FP1, between FP1 and C3, middle of this is F3. From F3 to O1, from C3 to O1, middle of this is P3. Similarly, in this case, from FP2 to C4, middle of this is F4. From C4 to O2, occipital, middle of this P4. So what we have done is, we have already found F3, F4, O1, O2, and C3, C4. But I just wanted to inform you, you have found F3 and F4. But the best thing is, if you take the inchy tape again, starting from F7, passing through FZ, passing through F8, where this line crosses at this F3 and F4, that will be actually true F3 and F4, which is shown in this last step, starting from F7, passing through F3, passing through FZ, passing through F1 and F4, where this line crosses at this particular point. This is particular true F4 and this is true F3. So this is how you need to find the EEG locations of the electrodes. So you have found out F3, F4, C3, C4, and O1, O2. Why these locations are important? Because I told you frontal channels are mainly will give you delta sleep, which is characteristic of stage N3, and it will also give you K complex, which is actually characteristic of stage N2. Central lobe will give you spindles, which is a characteristic of stage N2, and occipital will give you alpha waves, which is a characteristic of wake stage. So once we have found the EEG locations, we need to obviously prepare the skin for placing the electrodes. How do we need to prepare this? We have to have a good new prep cream and an earbud. So take the earbud, take this some new prep out, and clean the scalp to remove the dust, to have a better impedance and better conductance for getting the better EEG waveforms. So once you have cleaned it, you need to have an LIC2 cream or a 1020 cream, and you have to have a gold plated EEG electrodes ready. And then you need to place this cream on the patient's scalp, and then you have to have the gauge ready. just need to put on the cream, and that is it. So once we have done this EEG, once we found the EEG landmarks, and I showed you also how to put the EEG electrodes. However, I'll show you the practical part also on the dummy. Uh, so once we have found the EEG electrodes, we need to look at the once we have found the EEG locations, we also need to look at the EOG, because EOG is, please understand, EOG is also really important locations to find out, and EOG electrodes are also important because EOG electrodes and chin EMG electrodes are the ones where through which we can differentiate between RAM and non-RAM stage. What will happen in RAM stage? In EOG, the eye movements, rapid eye movements will be there. So EOG electrodes has to be placed and has to be placed at a proper position. So where our eyelid meets is called as canthus. So in this, right, this is right canthus and this is again the left canthus. So right canthus, 1 centimeter right, 1 centimeter above is E2. Again here 1 centimeter left, 1 centimeter down will be your E1. So E2 is up above 1 centimeter, E1 is 1 centimeter left and 1 centimeter down, E2 is 1 centimeter right, 1 centimeter above. So this is how you need to find EOG locations, and maximum impedance has to be 5 kilo ohms either for EEG or for EOG or for chin EMG. So once we have found the location for EEG and EOG, we need to locate the EMG where we need to put the chin EMG electrodes. So here is the mandible, middle of the mandible, 1 centimeter above from the midline is your reference point for chin EMG. This is reference. And once from here, it was 1 centimeter, now it is 2 centimeter left, 2 centimeter down will be your chin EMG 1, 2 centimeter right, 2 centimeter down will be your chin EMG 2. So this is how you need to locate and place the EEG and EOG and EMG electrodes. So once you have done this, the patient hookup is more or less ready. So what I will do is I will show you the I'll try to show you these things, same things which I discussed in the presentation on a dummy in a practical way so that we have a better idea. So let me stop sharing my screen and then we have a dummy ready with us. So I showed in a very first step that we need to locate 4 landmarks. We need to look at nasion. So nasion is a point where your nose meets your forehead is the nasion. You need to find out the inion. So what we need to tell the patient to move, to put his head backwards, and you will find the occipital protuberance. So you tell the patient to move backwards. So, and you see now this, if you once you going backwards, and you will find it somewhere here where the skull actually ending is the occipital protuberance, and the bumpy area where this bumpy area ends is basically your, where the bumpy area, which you will find it in the, you can feel yourself now on your head move backwards, and you will find the occipital protuberance or the bumpy area. Where this bumpy area ends is your inion. So this is now, this is like an inion here. You have found the nasion, and here you need to look at the preauricular point. Preauricular points are the points which is like notches at the ear. These are the preauricular points. The second step was, I told you that you need to measure from nasion to inion. So you need to measure the from nasion point to go back to the inion point. Go back to the inion point to the occipital protuberance. So in this case, it is coming to 22 centimeters. So in adults, it is generally, so since it is a dummy and not the actual patient, obviously, and a small dummy, so in adults, it is around 30 to 56 centimeters. So in this case of dummy, it is coming to 22 centimeters. So once we have found this 22 centimeters, we need to locate the central point, that is, that will be called as CZ. That will be called as CZ. So this is coming to 22 centimeters. So this is middle of this will be CZ. So it is, if it is 22 centimeters, let's see what it is. So no, sorry, this is 24 centimeters. So in this case, if it is 24 centimeters, the point, so 12 is half of this. So 12 here is CZ. So once we have found CZ, move forward from CZ towards nasion. Move forward from CZ towards nasion. So as I told you, this is 20%. So from CZ, so what we found was 24%. So 24 centimeters. So what we need to do is from from the CZ, move forward to your inion point. So 20% is 24, 4.8, 1, 2, 3, 4, 4.8. So this point is your FZ. So again, move forward 20%, 1, 2, 3, 4, 4.8. So you are this point is FPZ, this point is FZ. We have already found CZ. Now from the CZ, move backwards towards your anion. Move backwards towards your anion. So now from CZ, move backwards towards anion, 20% backwards. So 1, 2, 3, 4, 4.8. So this point, moving backwards, this point is PZ. So move backward again 4.8 towards anion. 1, 2, 3, 4, 4.8. So this point is your OZ and this is your anion. So from anion to OZ is 10%. OZ to PZ. OZ to PZ is again 20%. PZ to CZ is 20%. CZ to FZ is 20%. FZ to FPZ is 20%. It is clear. That is why it is called as 10-20 system, because either of the electrode is 10% to each other or 20% to each other. So this is our second step. So third step is from, as I told you this in the presentation itself, from pre-auricular point. From this pre-auricular point, it should pass to the point of CZ we have already marked, to the next pre-auricular point, to the right pre-auricular point. So in adults case, it is actually again 32 to 36 centimeters, and in this case, it is coming to 24 centimeters again. So it is 24 centimeters passing from CZ, passing to this point, passing to this point which we have already located in our previous step. So this is CZ. So let's see again. So what we'll do is okay. So this is let's see, this is 24. This is 24. So what we need to do is from the CZ, from this point, move towards left pre-auricular point. We found that it was 24. In adults, it will be actually 32 to 36 centimeters. Since it is dummy, we are using this measurement. So it is 24. So move 20% towards left pre-auricular points. It's again 4.8. So it's again 4.8 is, so let's move 1, 2, 3, 4, 4.8. So this point is your C. This is left side. So left is always denoted by odd number. So this is C3. Move backwards, move down towards your pre-auricular, again 20%. So you see, starting from here, 1, 2, 3, 4, 4.8. So this point, you see, this point is 10% from pre-auricular. So this should be 2.4. Yes. So from pre-auricular to this is 10%. This is called as T3. This is C3. This is CZ. Similarly, we move from CZ to right pre-auricular point, and again measuring, this is 24. In adults, it will be 36. So this is again 4.8 because it has to be 20%. 1, 2, 3, 4. Again 4.8. So this is C3. This is C4 because it is in the right side. This is C4. And now again move backwards 20%. So 1, 2, 3, 4.8. So this point is your T4. So what we have done is we have found T4, we have found C4, we have found CZ, we have found C3, we have found T3, which is, so at this moment we have found C3 and C4, which was required. We still have not found occipital channels, O1 and O2 we have not found F3 and F4. But we, as I told you, this we already have found FPZ. We have already found, what is this? This is left side, this is T3. We have already found OZ, and we have already found T4. So what we need to do is what we need to do is we need to measure the circumference of the head starting from FPZ, passing through T3, passing through OZ, which we have already marked, passing through T4, moving back, moving back, moving back, moving back, coming back to your same place of FPZ, coming back to the same place of FPZ. So what we have done is we need to measure the circumference. Starting from FPZ, passing from T3, passing from OZ, passing from T4, and coming back to FPZ. So in adults, it is generally 56 to 58 centimeters. But in this case, since it's a dummy, it is coming 40 centimeters. Okay, perfect. So it is coming 40 centimeters. What we need to do is, since it is 40 centimeters, so I showed you there are two exceptions here in this 10-20 system, that from FPZ to FP1 is 5%, FPZ to left side is again 5%, right side is again 5%. So let's see. So from it is 40, so we have to measure starting from, that is 5% is 2. So 1 and 2, this point is your FP1. So now since it is 40, so again you have to measure 10%. So this point 1, 2, 3, 4. So this point, this was FP1, this is F7, FP1, F7. Now again 10% is 40, 1, 2, 3, 4. This point is already, it's already marked in the previous this thing. This is what, T3. So okay, so again moving backwards toward OZ. So T3 again 10%, 1, 2, 3, 4 centimeters. So this point is this was T3, this point is T5. Okay, 1, 2, 3, 4. This is again 10%, because it is total is 40, so 10% is 4. So this point is your O1. This point is your O1. So what we have done is we already knew OZ. Now we have got a O1. From OZ to O1 is 5%. O1 towards preauricular point, 10% will be, this is T5. We already had T3. We already know, now we know we have F7, we have FP1, we have FPZ. Similarly, in the case of right side, if you see this dummy, similarly, if we measure starting from this point, moving from T3, coming back to OZ. So this is, we already knew that total circumference is 40. So starting from this point, from FPZ, 20%, sorry, 5%. 5% is moving towards OZ. 20% of this, sorry, 5% again, 5% of this is FP2. So that is 2 centimeters, because total circumference was 40. So this point is your FP2. Now 10%. So move back 10% is 1, 2, 3, 4. So this point is your F8. On the left side it was F7. This point is F8. So again move backwards 10%, that is 4 centimeters. 1, 2, 3, 4. We already marked this point as T4. Remember, this was already marked as T4. So we already had this point. So again move backward 1, 2, 3, 4. So this point here, it was basically T3 and T5. Here it is T4 and T6. This is right side, so it is T4 and this is T6. Now 10%, again move backward 1, 2, 3, 4. So this point, so this is T4, this is T6, and this point is your O2. So now And from this O2 to 5% is OZ. So this is OZ. So now we have OZ, which we are not interested in OZ actually. We are interested in O2, which we have already found. This point, we are interested in O1, which we have found. So O2 we have found, which is 5% from OZ, and OZ to O1 is 5%. Clear? So total circumference for 40 centimeters, and this is 2 centimeters from OZ to O2. OZ to O1 is again 2 centimeters. So this is our aim to find. This was our aim to find out O1 and O2, which we have already found. We have already found FP1 and FP1 and FP2. We also found. We also found F8. We also found T4. We also found T6. In this case, we already found F7. We already found T3, and we already found T5. Now, still we have missing F3 and F4. We have found O1 and O2. We have found C3 and O4, but we already still missing is F3 and F4. So now, please look at carefully. Since we already have FP1, I showed you FP1 we found. We already found C3 point. We already have O1. So FP1, C3, and O1. So what we need to do is starting from FP1, passing through C3, moving backwards towards O1. So this, in this case, it is coming to around 18 centimeters. It is coming to around 18 centimeters, passing through C3. So what is this? C3 is exactly at half the stage at 9 centimeters, and it is coming 18 centimeters. So between please note, between this FP1 point and C3 point, middle of this, that is, if it is 9, it is 4.5. This point is your F3. And from this 9 to this 18, middle of this 4.5, starting from 1, 2, 3, 4.5, this point is actually your P3. However, in sleep montage, we are not interested in this, but in case of EEG extended montage, this will actually come into picture. So this we have found P3, this we have found F3. Similarly, now we have to look at F4. So what we need to do is, we had FP2, which already was found. We had C4, which was already found, and we had O2 on the right side. So what we need to do is, again, we need to start from FP2, passing from C4, going towards O2, back. And this is again same 18 centimeters. Middle is coming 9 centimeters. So C4 is coming at around 9 centimeters again. So middle, starting from FP2, the middle point at 4.5 will be your F4. We have found F3, we have found F4, and similarly from this point C4, from C4 to O2, the middle point will be P4. We have found P3 and P4 also. So I told you P3 and P4 we are not interested, but we are interested in F3 and F4. We are interested in F3 and F4. But my suggestion or last step is that since you already have FC, you already have F8, you already have FZ, pass, just measure this F7 and FZ and F8, where this line crosses, this will be actual F3, and similarly between FZ and F8, where this line crosses, will be your actual F4. So you have found now F4, F3, C4, C3, O2, O1. That is what we are interested in, my dear friends. And now we have found this. We need to look at the EOG electrodes. EOG electrodes, as I told you, this is the right canthus where your eyelid meets at the canthus. So from the canthus, right side 1 centimeter lateral, 1 centimeter above will be your A2. Left side 1 centimeter lateral, 1 centimeter down will be your E1. So E1 E2 is obviously even numbers are on the right side, odd numbers are on the left side. So even on the left and on the down, E2, 1 centimeter right, 1 centimeter above is E2. So what we have done is we have found EOGs, we have found the EEGs. We need to look at the chin EMG. As I told you, chin EMG is in the middle of the mandible. 1 centimeter above is your reference from the middle of the line. 2 centimeter left, 2 centimeter down is chin EMG left, chin EMG 1. 2 centimeter right, 2 centimeter down is your chin EMG, chin EMG 2. This is chin EMG 1. 2 centimeter left, 2 centimeter down is chin EMG 1. From this point, 2 centimeter right, 2 centimeter down is chin EMG 2. So Stinium, we also need to look at the mastoids because mastoids are the reference electrodes and really important to find. So mastoids are the bony areas behind the ear which has low potential and less or no potential or very less potential actually. So this is very easy to locate, just the bony areas. These are the mastoids. So what will happen? The left side exploring electrodes will be referred to the mastoid M2 because this is non-exploring electrode which has no potential, and similarly right side electrodes which are F4, C4 and O2 will be referred to master electrode M1. So this is what we need to do. Once we have located the landmarks, obviously we need to place the EEG electrode which has to have a gold plated electrode because gold plated electrodes has a good conductivity. Gold plated electrodes have a they are good conductors, and we need to have an impedance which should be less than 5 kilo ohms. So we have to clean first where we have located the landmarks. We need to clean these landmarks as well as clean this dust which can be on the scalp to have a better conductivity. So what we need to do is we need to have good earbud. We need to have new prep gel ready and something. Yes. So what we need to do is we need to have a new prep gel. Take this new prep gel out, clean this area where we have marked, for example, we have marked CZ this area. So we need to clean this area with this. So it should be rubbed properly so that the dust should go away. But it should not be too, it should not hurt the patient. But yes, obviously we need to remove the dust. That should be the main aim. So once we have removed the dust with this, we just need to look at the gold plated electrode and then take the LIC2 cream or 1020 cream which you have. Take this out like an ice cream scoop. Do not fill like full, but take this like an ice cream scoop, which is good enough, and just look, put it like this. Some should ooze out. If it is oozing out, that's actually good. And once it is you have put this, the patient will have hair, so you put some gel on the hair and zigzag it up, and that is it. Also you need to have a gauge. You put some gauge, small portion of gauge, put some cream and put this gauge up, and that is good enough. The only thing is that it should move backwards. All the EEG electrodes should move backward to have a ponytail so that it should not be look bad and looks clean. So this is how you need to place an EEG electrodes, and that is what I wanted to show you today. Today the EEG electrodes, the placement of EEG electrodes, placement of EOG electrodes, and we will see sometime next presentation sometime. Thank you very much, my dear friends. Thank you.